Urbanization is a global phenomenon, but over the last few decades, this trend has been predominant in developing nations. Of the total urban population in the world, 10% are found in one nation, India. Over the next decade, India's urban population is likely to touch 550 million. An analysis of population growth trends between 1991 and 2001 shows that while the national annual growth was 2%, urban India grew at 3%, megacities at 4%, and slum populations rose by 5%. At present, the number of urban poor in India is almost 100 million. The most visible among them are the people living in slums. But there are also many others living without the luxury of a roof over their heads or other basic necessities of life. The living and working conditions of the poor have a direct impact on their health. Lack of toilet facilities and sewage systems compound the risk. Around half of all urban poor children miss total immunization before completing 1 year and are underweight. Out of every 1,000 children, almost 73 die before they reach 5 years of age.
If you look at the entire development story of this country, you will see that the rural poor have been benefiting from several sources, whether it is rural development programs or health programs or education programs. But contrast this with what has happened to the urban poor and you will realize they have not been provided those facilities. The National Urban Health Mission is to provide holistic health care which is affordable, in fact in many cases free, to the urban poor.
Since 2001, USAID has partnered with the Government of India in the area of urban health. In response to the proposed National Urban Health Mission, NUHM, USAID India started a technical assistance program known as Health of the Urban Poor HUP in 2009.
I think more recently, 2009 is basically where the HUP project developed. And I think this one was notable perhaps because of the extent to which it synced, it linked in with the government's own programs and sort of the engagement with, at a national level but also at a state level, it was aimed to make a difference. And again, I think it was very explicit.